That's amazing. That's amazing. Thank you. Thank you so
Okay.
much. So I would
Well,
I would definitely give the answers to all those things and then we will proceed. And I would love to welcome
excellent.
you. I've been following the Diabetes Chai since last 2 years and I keep getting updates about the same. So many guests you have been arranging for the society, doing such an amazing work and helping out the society to take control of this metabolic diseases is a big thing. Yeah. So kudos
Well, we've
to
got a
your
great
team.
team. We've got a great team. Now, the floor is yours for 15 minutes to chat to us about your issues and your areas of interest. And then we've got a number of people already lined up to ask you
Yeah.
some
So
questions.
before
So,
before we start, can you just tell me how much time would I be having to give a talk?
what
15 to
we would
20
love you
minutes?
to do is to speak for about 15 minutes, if you
Okay.
can. 15
Yeah.
minutes, and then it'll be 15 minutes of questions.
Okay, fine. I should try to wind up my stuff as soon as possible. Thank you.
The floor is yours. Thank you.
Thank you so much. So, hello, friends. Hello, good evening from Mumbai, India. And it's been like a 10:30 p.m. here in Mumbai. And before I start, the question which Mr. Kate asked me about why the American flag is behind. So, I'm professionally by as a endoscopic bariatric and metabolic physician. My specialization is into endoscopic bariatric procedures for weight loss which are non-surgical, innovative, and reversible procedures for weight loss. I am a physician and not a surgeon. This is my profession. My passion is with the flying, and I'm a international aviation medical officer for Government of India and Government of USA. So that is how my flag is there because I've been working officially for them. So without wasting much time, I've made a small presentation for you all today. I don't think I would be having much of time to discuss on all this part, but I would take you to the journey of about how these things works here. So this is endoscopic bariatric therapies, how it have been helpful for diabetes city and metabolic diseases. We all have been knowing how India is been getting affected with the obesity. This is the first slide of India. But again, worldwide Federation Obesity has mentioned that over the period of next year or 2025, there would be more than 1.5 billion people worldwide who would be affecting by obesity and overweight. And this obesity overweight we all know lead to all type of diseases like stroke, cancers, mental issues because of psychological impacts which are called as non-communicable diseases. Few years back, 3 4 years back, we had COVID, which was a communicable disease, but these are actually threats to our society which are non-communicable diseases here. And the key to treat all this is by reducing the weight. We all are having that the countries like developing countries are actually affected by the junk food habits which have been going. And there was recently an article which was published few months back which I was being involved there, and we see there is a surging obesity risk factors which are going up even in children's apart from the adolescent and obesity adults, because the children follow the stuff what the adults are following. And this is because none of the few countries have the food label policies, which is good, which is bad. Very optional things are there. So end of the topic about this article, which was published in Bloomberg a few months back, it has stated that the support group meeting which we conduct, the way chai chat is being organized by Silver Star and the initiated by Keith, Mr. Keith, is very amazing because this really helps to a big way, so this plays a very important role here. And Mr. Bloomberg, Mr. Krish from Bloomberg was here at my clinic to interview for the same, which was been published recently. Then the shape of these things, being a ape and a monkey, took a obese person, overweight person carrying a soft drink in your hand has been going for a long way. And this is not I'm sitting in Mumbai and in from India talking about, but I would thank today's talk because you took me to the memories of mine from the Department of Endocrinology, Watford, England. So this is where I was doing my fellowship here, understanding, and also one of the photo from the Oxford here. So it is worldwide what I have been working and seeing and working with different societies. we have seen that humans have come long way, leading to metabolic syndrome. 2 years back, when I had given my talk, it was about metabolic syndrome. And what is that metabolic syndrome? Is because when we have more of fat in your body, we overeat, there is no excess of exercises, leading to metabolic syndrome. Central obesity, high cholesterol, increase in bad cholesterol, and sugars, diabetes, and blood pressures. Any of these three are present, we label it as metabolic syndrome. And when we label it as metabolic syndrome, the quality of the life of a person goes down. And to treat this, the major thing is to treat the obesity, because obesity is the mother of all the diseases. And obesity is also being termed as a disease now, because till the time you lose weight, it is good. The time you leave those medicine, you leave working in a healthy way, you start gaining the weight. And most of the highest mortality rate today is because of the obesity. This could be because we see the blood reports, apart from that blood pressure, and if we see on the skin, these tags would be visible, and this could be also leading to insulin resistance in the future. As the age grows, the risk goes up. And very surprisingly, this is not only related to the stuff, but it is prenatal. Prenatal is because before the baby is born, this all things contributes to lead to obesity. The way the baby is born, whether it is a natural way or it is through the C-section, it matters a lot. Stress and anxiety, all this play a very important role here. Psychiatric drugs, anti-diabetic drugs like insulin, steroids leads to all this obesity, which is hampering all the organs of the body here. To treat this, assessment of your cardiac and diabetes is important. Controlling the blood pressure. C is for controlling the cholesterol. D is diabetic prevention, and E is for exercise therapy. So it is A, B, C, D, C, D, E. But is it that simple just with the A, B, C, D, E? If that was that simple, everyone would have been fit without having any metabolic diseases. But to treat this, it's not one person's thing. Yeah, you will require an entire army, including the physicians, a trained dietitian, a physiotherapist, a counselor, who can play a very important role, and to take care of all these essential eight, which are coming from the American desk, which says that you require a healthy food, healthy weight management by exercises, stress management, a proper sleep pattern. Proper sleep pattern plays a very important role here, because during your sleep, your metabolism takes place, and with that metabolism, you tend to maintain that weight. So these eight components are very important. By giving about the bad choices of the food, I won't go in details because this is a big addition, and most of them know which is favorable food for them, what are about the sweeteners, how they should be opted for, how we can go for antioxidants and maintain their vitamin D, B12 levels, which also plays an important role for maintenance of the weight. Importantly is the physical exercises. 1,000 calories per week is required. If I have to talk about the exercises for a week for healthy weight maintenance for long period of time, we require minimum 250 minutes or 300 minutes of exercises per week to maintain that. But is it that simple by just with diet and exercises? We have seen patients whose cholesterol was in control because their obesity was gone, central obesity part. So you see these people, like, we have treated them, but it is not always the same. We have options for bariatric surgeries and bariatric procedures, because not everyone can opt for that diet and exercises. So each one has their limitations. Medical management is different, surgical management is different, and non-surgical treatment is different. So there is a link between the diabetes and obesity, that is called as diabesity. And this has again come on from the Diabetes UK. When I was being there, I attended particular workshop on sleep apnea from the UCLH, and understood how obesity can even reverse your sleep apnea, where you are on CPAP, where you are not able to breathe much, and these machines have been put up. And things which can be achieved from weight loss is diabesity, thyroid issues, your NASH, that is fatty liver, obstructive sleep apnea. If females have PCOD, PCOS problems, or facing infertility, weight management can be done, which can be achieved with them. People with osteoarthritis, osteoporosis, knee joint pain, when they lose weight, this can be reversed. And of course, cholesterol and hypertension, definitely the pill burden goes down when you lose weight, and this all can be achieved with the lifestyle modification. We have a lot of medications now available like SGLT2 and GLP-1 medicines, which are FDA approved and are can be used for the weight loss and helpful for diabetes management as well. But is it that simple? When we are giving with diet, exercise, and medicine, why not everyone is able to lose weight? Here we introduce a filling gap between the pharmacotherapy, the medicines, and the surgery is endoscopic bariatric therapies. And this is the need of an hour because not everyone wants to go for surgery immediately. So, being a physician, I am talking about the procedures and not the surgeries, because this is a mid level before you jump from the pharmacotherapies, diet, and exercises directly to the bariatric surgery. We lies between something called as endoscopic bariatric therapies for weight loss. So it's a small scope with a tip. On the tip we have a light camera, and then it's about the action. And we have two type of procedures here. It is restrictive and malabsorptive. So restrictive is with the balloons, when we insert the balloon where the stomach has been filled with this balloon and you start losing weight with that. And the second is with the malabsorptive therapy where there it is called as endobarriers. I'll just show you the photographs of it. So this journey has been amazing, and since 2019, even American Society of Gastroendoscopy has said that it can be used full-fledgedly to lose the weight from a weight loss of way without any part of surgeries. So there have been medical devices which were approved but not used anymore now. But this is something called as Orbera system. This balloon is inserted into the stomach through a endoscope, left there for a year, and then we remove it back. So with this, you start losing the weight, and around 12 to 18% of the weight loss of we see over a period of 1 year. And these are the outcome graphs, these are the academic graphs, and it has shown that there is good results with it. This is something called as patch 3 balloons, and we opt, I personally opt more for this because this is the only adjustable balloon in the world which is available, where we insert the balloon into the stomach and we fill it with certain solution and we keep it for a year. Between 6 to 7 months, when we feel the patient is plateau and not losing the weight, we inflate it more and increase the size, and we see a good results and weight loss. This is my team. We are working in the OTs for the same, and this is my endoscopic view of those balloons. On the left, we see a deflated balloon, and on the right, we see a inflated balloon with the lace which is pulled out, and can the balloon can be adjusted with these things. So sharing with you a quick success patients of ours. This was a patient who was there last year with me, who was like 139.5 kgs, and today last week he had come with 15 on 15th March 2024. He was 106, who has lost like almost 33 kg. So a whooping of 33 kg loss, kicked off tobacco since a year, of CPAP, which is reverse sleep apnea, less burden pill for diabetes and hypertension. This is a proof of dedication and perseverance path to the transformation of someone's lifestyle. Another patient who had paralysis, who was undergone with this balloon, has lost significantly. His age was 53, has lost significant weight of 20.5 kg in less than 3 to 4 months. He's maintaining that. Now he's able to even take some steps because he was 143 kg, today is 122 kgs, and he can take some steps, and the paralysis is still there, but there is improvement in his power of hands and legs as well. We had a certain international patients whom they had visited like few years back in 2022, and then they opted for balloon just 6 months back, and they were from Germany, and she's one of it. This is my another team, and she is today, this was last week when she was 104 kgs, and from our online consultation from the Zoom platform, when we took the follow-up, we found out she is now 83, like losing around 17 kgs. So when 17 kgs they lost, they have reduced the peel of burdens, diabetes, and the metabolic diseases also into picture. She's one of our friend, I can say a student and a doctor by profession, who is a gynecologist. Even she opted for it, and we see a loss of almost 30 kgs within a year here. So it varies whether you lose 12% to 15 to 18%, and it has been a non-surgical. You see a good weight loss, no incision, no hospital stay, weight loss therapy is there, and ideally for the to be groomed to be bride people, because it's a reversible procedure, no surgery here, and good for mild to moderate obesity. There are certain other endoscopic procedures which can be opted, which are a part of endosleeve which we suture the stomach from inside and we make the stomach sleeve here. Another option which is into clinical trials, we burn the duodenum of the intestine where metabolic hormones like insulin is made here, ghrelin and peptins are made here, which alters the hormones here, and diabetes can be reversed. But yes, this is still under the clinical trials and not out for the people yet full-fledgedly. The futuristic is endoscopic bariatric procedures with the medications which will be helpful for weight loss, and very importantly behavioral therapy plays a very important role. So when we see this baby, a cute baby, but the perspective have to change now. He or she is not a cute baby anymore. We need to treat these patients and these babies for a future healthy perspective here. So this is the
Dr.
motivation.
Ketan,
It is,
if I could,
yeah.
Doctor, if I could ask you to wind up in about a minute, that would be fantastic.
We are finishing it. So it is not about losing the weight, it is about the quality of life we gain. And very importantly, we need to understand the music of our body so we can opt for it. The global threat was not COVID, it is the obesity part, diabetes part, and metabolic diseases, which is very important for us. So this is all from my end, and I want to thank my entire team of Metabol who is working with me for the same year. Thank you so much.
Thank you so much, Dr. Ketan. You've got so much information in the 15 or so minutes